Hello. We're back again with a special edition of the video magazine edited just for cardiology. Imaging product news, Cardiology Special, with stories about all that is new worldwide. Jose Ferrer's play has been extended in London this fall. I'm Gene Knight, your news editor. This edition has been planned to show you many new things to be seen during the American Heart Meeting in Washington, D.C., November 14 through the 17th. In this issue, we'll look at many new areas to be displayed during American Heart. Mansfield Scientific has long been seen as an innovator in percutaneous transluminal coronary angioplasty. We'll look at some new innovative approaches to be seen in greater detail during AHA. The Washington Convention Center is to be the site of this year's AHA. We'll look at the hall and see if we can ease your search for meetings, scientific exhibits, commercial exhibits. Nitrate tolerance is a real problem. Reed and Carnrick presents a topical conference with two authorities, Dr. Jonathan Abrams of the University of New Mexico School of Medicine with Dr. Sigmund Silber of the University of Alabama at Birmingham. At long last, we will look at a number of Philips technical products with special interest for the cardiologist. You've read about the use of positron emission tomography, known by the acronym ECAT-PET, as the leading method to image metabolic function in the heart. Now, Siemens has brought this technology to amazing heights. For nearly a century, throughout the world, people with angina pectoris have found relief from the crushing pain of an angina attack by taking sublingual nitroglycerin tablets. The success of this original nitrate therapy, in terms of its speed and effectiveness, prompted investigation for additional nitrate compounds and new dosage formulations. The goal of much of this research was to use the potent therapeutic activity of nitrates in a formulation which would prevent angina attacks from occurring. The development of transdermal patches, long-acting nitrate formulations, and sustained delivery systems were each hailed as therapeutic milestones in the management of angina. However, even though these early formulations and dosing systems could deliver nitrate compounds more or less consistently and predictably, they could not overcome a problem which has haunted nitrate therapy since its discovery, the problem of tolerance, in which the body may become virtually unresponsive to additional medication. Dr. Jonathan Abrams of the University of New Mexico School of Medicine is a leading authority on nitrate therapy for angina pectoris. Dr. Abrams is joined in this videotape by Dr. Sigmund Silber of the University of Alabama at Birmingham. Dr. Silber's pioneering work on sustained-release nitrate formulations, such as Dilatrate SR, has demonstrated that tolerance can be avoided in patients on long-term nitrate prophylaxis. The following presentation by Reed and Carnrick explains how Dilatrate SR, with its patented microdialysis delivery system, can offer the protection of sustained-release isosorbide dinitrate while reducing the risk of developing nitrate tolerance when used as an asymmetric dosing regimen as described by Dr. Silber.
Long-acting nitrates provide convenient prophylactic treatment for angina pectoris. Although sustained delivery formulations may provide constant levels of the drug, ultimate effectiveness is impaired by the development of tolerance, in which the body may become virtually unresponsive to additional medication.
Sublingual nitroglycerin and the long-acting nitrates are amongst our most effective agents for the treatment of angina. These drugs have been available for well over 100 years and are familiar to physicians throughout the world. Recently, we've discovered a new and unexpected problem with these compounds when administered frequently and in long-acting formulation, and that's the problem of tolerance or attenuation of effect. This may come on as early as 8 to 12 hours after administration. Dr. Sigmund Silber of Munich, West Germany, and now of the University of Alabama, has done considerable investigation looking at a long-acting or sustained-release isosorbide dinitrate oral formulation. He has shown that an asymmetric dosing schedule providing a nitrate-free interval seems to eliminate the problem of tolerance and provide sustained anti-anginal effectiveness.
Dilatrate SR can help break the tolerance barrier. Dilatrate SR, with its patented microdialysis coating, delivers isosorbide dinitrate in a controlled, predictable manner that can help avoid tolerance development in the patient. After ingestion, the Dilatrate SR capsule dissolves, releasing hundreds of microdialysis cells containing isosorbide dinitrate. Each cell is defined by a semi-permeable membrane. When the membrane comes in contact with liquid, its pores open to release isosorbide dinitrate. As the concentration of isosorbide dinitrate on the inside of the membrane is reduced and the surrounding level increases, the pores open wider, thus maintaining a gradual, predictable release of the active drug. The microdialysis process ensures that drug delivery is uniform despite changing pH conditions in the gastrointestinal system. Stress testing has clearly demonstrated up to 8 hours of anti-ischemic activity for Dilatrate SR. A single oral dose of 40 milligrams results in marked improvement in exercise duration and work capacity. With its uniform delivery system and duration of action, Dilatrate SR lends itself well to an exciting new concept, asymmetric dosing. Studies performed by Dr. Sigmund Silber have demonstrated that an asymmetric dosing schedule of sustained-release isosorbide dinitrate can circumvent the tolerizing effect observed with other preparations and dosing schedules.
Compliant patients can develop nitrate tolerance if the tablets are prescribed for frequent dosing. To avoid nitrate tolerance, it is essential to implement a daily nitrate-poor interval. In our studies with isosorbide dinitrate in sustained release form, we custom-tailored different dosage intervals. Keeping in mind that the ultimate goal of nitrate therapy is not only to avoid nitrate tolerance, but also to offer the patient a long coverage as possible throughout the day, we found the asymmetric dosage scheduling the best. Patients ingesting the tablets at 8 a.m. and 2 p.m. had a good anti-ischemic protection during the day without the development of tolerance. Therefore, in order to reduce the number of tablets to be ingested, I recommend the intake of isosorbide dinitrate in sustained release form in the morning and early afternoon.
The key to the success of Dilatrate SR in preventing tolerance is the predictable metered way its microdialysis coating liberates the drug, and when dosed properly provides the required nitrate-poor period for reducing the risk of nitrate tolerance development. The unique microdialysis system makes Dilatrate SR suitable for asymmetric BID dosing. This simple regimen provides the anti-anginal protection of isosorbide dinitrate during active hours. The nitrate-poor period occurs when most patients are sleeping and less likely to suffer a stable angina attack. Dilatrate SR used in an asymmetric dosing regimen may prevent tolerance development in patients while protecting them from the crushing grip of an angina attack. Asymmetric dosing with Dilatrate SR, the protection of sustained-release isosorbide dinitrate without nitrate tolerance.